Welcome to the Explainer. Okay, let's talk about one of the most dreaded procedures in all of dentistry, the root canal. But what if the biggest issue isn't the procedure itself, but actually how often it quietly fails, sometimes years down the line? It's a question we just don't really ask, right? You go through it, you get it done, and you trust that it's fixed for good. But when you start to dig into the actual data, a much more, concerning story begins to take shape. So check this out. This number comes from a study at Tokyo Medical and Dental University, and what it suggests is that in Japan, the long-term success rate for a conventional root canal can be as low as 60%. Let me put that another way for you. That's a 40% failure rate. And we're not talking about some rare complication here. This is a widespread problem. So widespread, in fact, that it prompted some dentists to start questioning the entire foundation of the procedure itself. The fancy clinical term for this failure is apical radiolucency. It's basically what a dentist sees on an X-ray when things have gone south. And as this study shows, you're looking at failure rates between 30 and 50%, depending on which tooth it is. The odds are pretty much a coin toss. Not what you want to hear, right? So these staggering failure rates, they led a Japanese dentist, Dr. Kubokura, to develop a really contrarian approach. And he didn't start with some new fancy gadget, but with a completely, radically different philosophy. For decades, the conventional wisdom was all about cleaning, disinfecting the inside of the tooth. That was priority number one. The K.SRCT method just flips this on its head. It argues that, cleaning is important. But the final, perfect seal of that root canal, that is what truly matters most. The logic here is just beautifully simple. Think of a cork in a wine bottle. If that bottle isn't sealed properly, the wine's gonna spoil. It doesn't matter how pure it was when you put it in there. It's the same for a tooth. An imperfect seal basically guarantees failure down the road. The seal is, it's everything. So how do you actually put this philosophy into practice? Well, it's not with some expensive, complicated technology. It's through an elegantly simple and repeatable set of rules. That's it. Just 6. The entire method, which is known as K.SRCT, is built on only 6 simple, verifiable rules. Now, these rules, they're designed to take all of the guesswork and the variability out of the equation. Everything is standardized. We're talking about the precise shape of the canal, the exact size of the opening, and then there's rule number 6, which is just absolute. If the fill isn't perfect, you do it over. No exceptions. No good enough. This whole process, all 6 rules, they're designed to create one specific thing: the pad. This is the holy grail. It's the physical proof that you've got a perfect airtight seal. It's this tiny, purposeful little puff of sealer that goes just beyond the root's tip, and it confirms the canal is 100% filled. Here, you can see exactly what we're talking about. The diagram on the left shows how the filling material is packed to create that all-important seal. And then, the X-ray on the right, that's the proof in the pudding. That little white pad at the end of the root. It's a clear, unambiguous, verifiable sign of success. Okay, so this standardized approach is really impressive in theory, but it's the results in practice that really build the case for a new standard of care. And a bit of a warning. In a review of 150 cases using this K.SRCT method, the success rate for the simple, single-root teeth was 100%. 100. And the overall average was over 95%. Now just remember that number we started with, around 60%. The difference is just staggering. Which, of course, brings us to the most obvious question. If this thing is simpler, cheaper, and way more effective, why isn't it the standard of care everywhere? Well, part of the answer is that K.SRT doesn't just add new rules, it actually throws out some old established practices. Specifically, it argues that a material called calcium hydroxide, this medicated paste that's routinely used in conventional treatments, is completely unnecessary and maybe even risky. So on the left, that's the material, how it's sold. And on the right, these images are from a peer-reviewed oral surgery journal, and they show what can happen when this stuff gets accidentally pushed past the root tip. We're talking severe tissue damage, necrosis, even permanent nerve injury.
The K.SRCT method just eliminates this risk by, well, not using it at all.
And that really brings us to the core lesson of this entire method. And honestly, it's a lesson that goes way beyond just dentistry.
When you put it all together, the argument is just so compelling. You've got a method that's more successful, it doesn't need expensive equipment, it's simpler for any dentist to master, and it's based on objective, clear standards. It just makes successful root canals more accessible to everyone, period.
And that leaves us with this final thought. The K.SRCT story is such a powerful reminder that the greatest leaps forward, they often don't come from making things more complex. They come from having the courage to pursue a radically simpler path. Makes you wonder, what other huge problems are just waiting for that same kind of thinking?